Knock, knock, knock. Hi, my name is Karen. I'll be your student nurse today. I'll start off by getting your name and date of birth. Sue Quinn, 7/21/1951. And then can I get your allergies? Levofloxacin and strawberries. By any chance, are you allergic to latex or shellfish? No? Okay. I'll go ahead and start cleaning my table and make sure it is sterile for the procedure. The manufacturer label says that this needs to be wet for 2 minutes for it to be cleaned. So we'll go ahead and just clean it now and allow the allotted time. Before starting the procedure, I would make sure that the patient is educated on what the procedure looks like, and then address any concerns or questions that they have. If they are concerned about pain, I would administer pain medication, although it is typically not a painful procedure. Alright, Ms. Quinn, it looks like we have an order to put in a Foley catheter, so we're going to go ahead and proceed. I'll put you up to a more comfortable position. Okay. Pericare does need to be performed before starting this procedure. For this demonstration's sake, I know that it has been performed already by either myself or a nurse technician. That or sometimes kits do come with Pericare cleansing utensils, but for this demonstration, we know that it has been performed. Alright, so I'm going to expose your area to where I need to work. So I'm going to pull down the blankets and lift up your gown. And then for the demonstration's sake, I am using the correct model for this procedure. Has the mark right there. So I have my kit right here. Go ahead and open it. So that would be my sterile kit, and then I have my sterile gloves, which I can set right here. And then normally the patient would be in a frog leg position. So I'm going to go ahead and position you so I'm able to properly insert the catheter. So, okay. So now I'm going to go ahead and proceed. So those are my sterile gloves. I will go ahead and open away from me first, keeping note of my borders that I am allowed to have. So I've opened up my sterile field. I'm going to go ahead and put on my sterile gloves. now that I have them on, I can adjust. Get rid of the trash I don't need. All right, so now I can go ahead and set up the things I need, while again keeping note of my sterile field. So again, I know pericare has been performed, so I am okay to start draping. This will go under the patient with sunny side down. To apply this, I would ask the patient to help out in a way that they can. So I'm gonna go ahead and try to do so without contaminating. Just as needed without contaminating. And then I don't need these gloves, so I'll go ahead and set them aside. And then my drape. And then I have my lubricating jelly. I'm gonna go ahead and release the bubbles and air from my saline water. Oh, it's okay. So since I let go a little bit more than what I need, I now have 9 milliliters into my syringe, which is okay because depending on the order for my Foley insertion, that would be fine. Sometimes it only requires 9 or 10, but if anything, I would just get a new one since it's less than what the packaging says. So we'll go ahead and proceed, but I would have gotten a new saline water. I would go ahead and put this onto my catheter. I'll let this come out. I have my cleaning utensils here. So this is iodine. Okay. And then I'll go ahead and put my cotton balls in there. And glue them here. Okay. So now that I have everything set up there, I will go ahead and clean my patient. So this hand was going to open up the labia majora and it would be contaminated, so I will not move my hand from that area. Using my iodine filled cotton balls, I will go ahead and clean. Okay. So I have So I would go ahead and open it. And then with the Kanba, I will clean from the area going up and down away from me first. And then I would throw that away in a biohazard bag. And then I would then clean to the area closest to me. Throw that away in a biohazard bag. And then using my last one, go ahead and clean down. And then that would be contaminated. So now that I know it's clean, I will go ahead and bring over my kit into my sterile field. I'm not removing my hand from this area. I'm gonna go ahead and proceed with the insertion. So I'm gonna look for the urethra opening, and for a female, I will insert until I see urine, which is usually about 3 to 5 centimeters. But what I'm looking for is a urine. In this demonstration, I would not be able to see that. So I'm just gonna go ahead and insert. On a male patient, it would be about 7 centimeters, again, until I see urine. So I would go ahead and open and insert. Okay. And then we'll go ahead and say we feel some resistance. So we're gonna go, or we'll see some urine, excuse me. I'll go ahead and hold on to the catheter with my contaminated hand just to make sure it does not slip, and then inflate my balloon. Okay. Since we have inserted the water, we are now not concerned about contamination or sterility. I can go ahead and remove my bag. Okay. And then I'm going to tug until I feel some resistance, and that will let me know that the balloon is inflated, and I do feel some resistance here, which is good. I can now remove my areas. I am no longer worried about contaminating or about my sterile field. So at this point, I would go ahead and start cleaning up. The patient would be done with the procedure. Go ahead and throw this away. And then when I document this, I would document how the procedure went, how the patient was positioned, and how the patient tolerated it. I would continue to monitor the patient for any signs of infection or discomfort, and then just make sure that the urine output is looking good. I would also document how much saline fluid I injected. That way, when it is time to discontinue the Foley catheter, it is well documented how much the balloon was inflated with. So when I tape it, I want to make sure there's some slack. To allow for movement. And then when I hang this bag, it is going to hang on the rails. And I want to make sure it is in the level below the bladder. So we ensure that, oh, there we go. So we ensure that gravity is doing its thing. And I also want to ensure that this is clamped to avoid any spillage. But I would then position the patient back to a comfortable position. And that would conclude my video.